Okay, read more, nurses. It's game night. I see you piling in. Let me know where you're from. We got all these nurses ready to play games. I usually don't play games, but tonight we're playing some Nclex games. I am excited because this is a cash prize event. So if you don't know how to get on, it's super simple. Yes, it's super simple. Go on to, okay, let me tell you two things first. You're going to need to have your computer and you're going to need to have your cell phone to play tonight. And so what you will do is you'll read the questions with me from your computer, but you will be answering on your phone. Let me show you how to get there. It's super simple. You're going to go over to Kahoot, www.kahoot.it, kahoot.it on your cell phone. And then it's going to ask you for the game pin. Yeah, it's a simple little game pin. You're going to put in, I see you, Benji. I see you, Naya. Kelly with 2 Y's. You're going to put in the game pin 3585566. That's the way we're going to play this game. We got over 200 nurses right now signed in to Kahoot, Facebook, YouTube. This is your time. I need you to go over to, on your cell phone, www.kahoot.it. Or go ahead and scan it. If you got your cell phone out, do me a favor. Just open up your camera. Use this QR code. Pow! It'll get you right there. I see you. Go ahead and do that and then put in the game code 3585566. And we're playing for prizes tonight. Top winner on here will get $100 cash app. Woo! And then we also have prizes for second and third place as well too tonight. Many chances to win. If you share this video, if you share this game night tonight, you will also be entered into a prize we're going to check. I want everybody in our community to know tonight we are playing games for money. Listen, I tell you guys all the time, the knowledge that you guys carry is worth dollars. It literally is worth dollars. And this is a fun way for us to study. So 2022, we're doing something new. We are doing something new. West Palm in the house, Detroit in the house, letting you guys go over to www.kahoot.it and putting in our game pin. Howdy. Facebook is asking for the link. It's super simple though. On your phone, you just go over to kahoot.it. I see you, Brianna. Clay is getting it. I was waiting for you, Katie. I was waiting for you. Kansas City, Missouri, Cleveland, ready to go. We are going to get started. I'm just giving everybody a chance to get in. It's simple. You there? www.kahoot.it. I'm so excited for this. I want to know if y'all really been studying. And the people that have been studying with me, you may see some questions like, hey, Regina, hey, you always use that question. I do because it's my favorite. And so tonight is game night. Let's go, Rebar Nurses. $100 cash prize. The first place winner. There will be 3 winners, but there can only be 1 main winner. Will that be you? Will that be you on tonight? Seattle in the house. I love the 3-hour difference. Pembroke Primes. Man, love you guys. Was there last winter. Chioma, I see you. Josie, yes. Okay, so shout out to MP's vlog. Said, hey, I passed my Nclex RN. Always. Hey, love that. Congratulations, guy. All right, go ahead. I'm gonna give you guys 2 more minutes to find this link, because listen, once we get started, your chances of winning decreases if you come in late, because you start racking up points from the very beginning. All right. So share this video so that we can go. Anyone playing from their desktop. So literally tonight, if you want to play, you got to have 2 things. You got to have your computer and you got to have your cell phone, because you'll answer on your keypad. And then you will be watching the questions that I'm reading on your computer. You got to have 2. How many questions? Until it feels right. All right. Nancy's in. Here we go. Last time, www.kahoot.it. And for those of you that have been on, just keep refreshing it so you don't lose your place. All right. www.kahoot.it. I got to get started. All right, if you don't have it, go ahead and scan your QR code. Yes, Canada, Saskatchewan in the house. Game pin is 358-5566. Let's go, everybody. Let's go. We're going to get started. All right. Okay. You're in. I don't know if you can see that you're in. You don't type it on your computer. You're going to be picking. You're going to be picking the colors of the right answers. All right. So we're going to get started. I see some people coming in. I'm trying to be generous. I don't want to close the gates. Lily, hurry up. Hurry up. Trina, AJ, Laura J. Oh, I'm tarrying. I'm tarrying for the latecomers. I'm tarrying for the latecomers. All right. Make sure that pin is right. Last time, final time. 358-5586. Woo, you guys are killing the game. 5566. Thanks, Mark. All right. Okay, I gotta go. It's time to start. There were people who were on time. All right. Good luck to everybody. This is going to be an amazing Nclex game night. This is the first time I'm ever doing something like this, so I'm excited to see how this goes. But I thank you for participating. 2022, here we go. I'm nervous. All right, y'all just like, hurry up, Regina. All right, Regina's going now. All right. This is the Kahoot by Remar review. This is the Nclex game night. 3, 2, 1. First question. A client has been treated for multiple organ failure and has had major thoracic surgery. Which of the following indicates the artificial airway should be removed? Is it gagging, reported increase in pain, restlessness, or clear lungs on auscultation? Has a client, they have had major thoracic surgery. What indicates that airway should be removed? What do you guys say? Gagging, restlessness, reported increase in pain, clear lungs on auscultation. Smash that color that you think is right. 247 people have answered already. What are you waiting for? What are you waiting for? Here we go. Okay. You got 7 seconds left. Hurry and make a decision and put it on the screen. I want to know who got it right. Here we go. And the correct answer was gagging. Yes, the correct answer was gagging, guys. And I'm going to tell you why. Okay. BJ. All right. There we go. These are our top scores right now. Fast fingers. You get points for how fast you are too. Okay. You get points for how fast you are. But remember, gagging, it indicates that you're able to clear the airway. It indicates that you're able to perform adequate oxygen exchange. So that is the correct answer here. I'm moving on. Now we know how to play. We're warmed up. Here we go. Next question. A nurse is teaching a conference on ketoacidosis. Okay. A nurse is teaching a conference on ketoacidosis. He is aware the most common cause of ketoacidosis is which of the following? Is it hyperglycemia? Is it anesthesia-induced, hypoxia, or peripheral vascular disease? Come on, guys. Come on. Give me the color. Those answers are flying in. And tonight is all about just having a good time, okay? Go ahead and pick that color that is calling to you, that is resonating to you. We're talking about ketoacidosis. You got 20 seconds. Slow down and think, okay? I know this is game night, but it is important. This is important training for when you're actually taking the Nclex. Somebody know what I'm talking about, because sometimes we just get so excited, we pick the wrong thing. So ketoacidosis is a complication. Who got that? The majority of you got that right. The majority of you got that right. Hey, let's see the scoreboard. Now, it may not change because it says, look, Mo climbed up to the highest. Danny, I see you. I see you. Let's go. Let's go. Hyperglycemia. Hyperglycemia happens when you don't have enough insulin. And so ketoacidosis is a result of untreated hyperglycemia. Many of you knew that. For those of you who didn't get that right, I want you to be thinking, okay, this is a game, but maybe I need to be studying some more on this. All right. Let's keep going, guys. So a nurse gets floated to the med-surg unit, and there's a client diagnosed with C. difficile colitis. All right. The client has C. difficile colitis. Which of the following are the most important to prevent the spread of the disease? Is it goggles and gown? Is it hand washing and gloves? Is it gloves and goggles? Or is it gown and a face mask? Infection control. How important is this? Okay, how important is this? We are talking about C. difficile. Okay, so what is going to be the most important to prevent the spread of disease? Come on, y'all. I know y'all know this one. I know we don't even have to, we shouldn't even have to count it down. It should be an automatic, but there may be some that won't get it right. So this is all part of learning. This is the largest study session right now on the planet for Nclex. Guarantee it. We in here, y'all. Did you get that one? Did you get it? Some people may have picked a different color, but yes, hand washing and gloves. That was yellow, right? Hand washing. No matter what we're talking about for Nclex, you got to go with that when it is talking about the spread of disease. For those of you who didn't get that right, catch this point. There is nothing more effective than washing your hands between patients. There's nothing more effective than that. So even if you see gown and face masks and respirator masks, forget all of that. Basic hand washing keeps everybody safer, okay? Safer. I'm moving on. Come on with me. Next question. The nurse manager has assessed that the client's conditions on a busy medical unit are higher in acuity than anticipated, right? So which is the most appropriate action for the nurse manager to take? So should the nurse manager request 1 to 2 nurses to work an extra shift? Should she contact a travel agency for further assistance? Use nurses from a temporary staffing agency, or leave the staffing as it is? Leave the staffing as it is. What is going to be the most appropriate thing for that nurse manager to do? The patients are more difficult than what she expected. So what should she do? Go ahead, also put your answer on the screen. All right. Share this video. We're giving out prizes, cash prize to the person who gets them right. All right. Then the most appropriate thing. Hey, who got it? Oh, it was actually red. Did you guys get that one? Red. Let's see what's happening. Did we have some movement going on? Just a little bit. All right. So it was red. Let me tell you why it was red. I see a lot of answers. Requesting 1 to 2 nurses to work an extra shift. It is always better for the nurse manager to use current trained nurses. Okay. And I know in the real world, right, we call staffing agencies, we get temporary nurses, but those nurses, not only do they get paid more, so they increase hospital costs, but they also require training. And so if there's an option ever between using staff nurses or using temporary or travel nurses, the best thing to do is use the staff nurses because they're familiar with the unit, their pay rate is stabilized, and yeah, that's it. All right, so don't get fooled by that one. All right, let's go on. Let us go on. Oh, prize alert. There's a prize alert already. Okay, so the first person to 5,000 points will win a question bank, will win a Remark question bank. Okay, so what you need to do is just screenshot, hey, this was me, and we will make sure that you get your prize. Okay, screenshotting is very important. First person to 5,000. Here we go, guys. Next question. I'm reading them out loud to you. Levothyroxyzonium, okay, is administered orally to a hospitalized client with congenital hypothyroidism. The child vomits 10 minutes after the administration of the dose. The most appropriate nursing action is to Is it hold the dose for today, contact the physician immediately, give 2 doses of the prescribed medications on the next day, or repeat the dose? So you have a patient, they were given an oral medication and they throw it up. What is the most appropriate action for that nurse to take? Ooh, and I already see so many different answers, so many different colors. This is the fundamentals. I can't wait to reveal this answer. Oh, okay. This is going to be very, very interesting and very telling. The most appropriate thing is to repeat the dose. The second to the smallest got that right. And let me tell you why. Let me tell you why, guys. Because let me see the scoreboard. Oh, okay, Marcella, I see you. The reason why is because remember, if a client vomits within 1 hour of taking a PO medication, you have to administer that dose again. And we were told in the scenario that it was after 10 minutes. And how long does oral medication take? How long does oral medication take to get into the system? It takes about an hour. So if you give a patient medication and they throw it up right away, you can be pretty certain that their body is not going to absorb that medicine. Okay. Their body's not going to absorb that medicine. All right. We're moving on. This is prize. I don't know. They may stop me and say prize time. Here we go. In caring for a newborn delivered spontaneously, which of the following findings need further assessment? Is it an irregular breathing pattern, nasal flaring at rest, increased heart rate when crying, or abdominal breathing? Got a newborn delivered spontaneous. Which of the following findings need further assessment for the newborn? Be very careful, guys. Be very, very careful. Okay, I already see the answers. Be very careful. Are you worried about irregular breathing pattern, nasal flaring, increased heart rate when crying, or abdominal breathing? Think about the age. Think about the age. You're getting close. You guys are really doing a good job. Let me see what we got here. Hey, that's what I'm talking about. Over 200 got the right answer. It is that nasal flaring. Let's see, did that change our leaderboard at all? Okay, and just like that, we got a new one very close to 5,000. Okay, a lot of people pick the irregular breathing pattern, but indeed nasal flaring at rest, right? Nasal flaring in newborns indicate that they are not doing well. They're not doing well. They're not getting enough oxygen. So you have to address that nasal flaring. Good job. Good job. Okay, I know we got a lot of ped nurses. Okay, Jason has smoked an average of 2 packs of cigarettes per day for the past 25 years. Calculate his smoking exposure in pack years. A little bit of math for you. So 2 packs of cigarettes per day for the past 25 years. Is it 25 pack years, 50 pack years, 2.5 pack years, or 5 pack years? Okay. All right. I don't have too much to say about this. It's either you know it or you don't. That's how math works with Nclex. Can't really explain the formula. But a lot of people are going with yellow. A lot of people are going with yellow. I see there's a couple reds too. All right. So we are talking about pack years. Let's see who got it right. The majority of you. I didn't have to explain it. You knew it. Amazing, guys. Amazing. And our leaderboard. Hey, I think we might have 2 people, but certainly Nicole B, you got to 5,000 first. Congratulations. Amazing, amazing, amazing. You're our current leader. I'm moving on. Here we go. 50 pack years. Yes. So pack years are calculated, and a lot of you guys knew this, by multiplying the number of years smoked by the number of packs smoked per day. Yes, the number of packs smoked per day. All right. And you have to understand a pack of cigarettes is considered 20 cigarettes. Yes. So you would just, the reason why we got that one correct is because he smoked 2 packs a day for 25 years. So you just multiply 2 times 25, and the correct answer was 50. It was 50. All right. We are moving on, guys. We're moving on. All right. Next question. All right. Send an email, Nicole B, with your screenshot and to claim your question bank. And that's how we will roll. For everybody that doesn't know, my email address, just in case you win, is support@remarreview.com. Okay. Support@remarreview.com. Okay. We got to keep going. Here we go, guys. This is question 15. Trina comes for a visit to report episodes of chest pain in the past 2 weeks. What information about chest pain is essential to ask? Okay. Is it, where is the pain located? What is your current weight? Do you have maintenance medications? Do you have high blood pressure? What is the most essential question to ask? All right, Crystal, I love you. I'll see you later. All right. Crystal says, I got to go. I love it. I got to go. All right. Shout out to everybody at work that's also participating in this game. How, Sway? How are you doing that? We're talking about chest pain. Hey. And what is the essential question to ask? All these questions are great, but what is the essential to ask Trina about her chest pain? Okay. Amazing. You guys were almost in solidarity here. All right. Where is that chest pain located? Did the leaderboard change at all? It's close. Okay. All right. Here we go. And the reason why, you guys, is because we always start with assessment. So the onset of pain, its location, its duration are going to be very, very important. Very, very important to ask. Okay. Okay, here we go. Next question. The nurse is educating a client with coronary heart disease about nutrition. Okay, coronary heart disease about nutrition. Which of the following should she emphasize? Is it going to be eat 3 balanced meals per day, limit sodium intake to 7 grams per day, add complex carbohydrates to the diet, or avoid very large meals? Okay. What do you say? We're talking about coronary heart disease and nutrition. What should she emphasize? Ooh, this one is tricky. Eat 3 balanced meals per day. Add complex carbohydrates to the diet. Limit sodium intake to 7 grams per day. Or avoid very large meals. Oh, this one is tricky, guys. I threw in some distractors. Here on purpose. I got some people. We were divided with this one. Okay. We were divided with this one. The correct answer here is actually going to be avoid very large meals. And so for clients who already have blockage in the heart arteries, eating and digesting heavy meals, it may increase the heart rate, it may increase the blood pressure, and it may cause rupture of arterial plaque that can lead to a heart attack. And remember when Nclex is talking about something that should be emphasized or something that is very important, I want you guys to think of life-saving things, right? And so, yes, it is great to eat 3 balanced meals per day, but avoiding large meals is going to be very important, not only for patients with coronary artery disease, but also with COPD, congestive heart failure, right? Because it takes a lot of energy and a lot of work when you eat a large meal. It's very strenuous to the body. Okay, so that was the reason why that was the correct answer. Next question is this. The day shift nurse is preparing to feed a client via a nasal gastric feeding tube. Which of the following is the most important action of the nurse? Is it check if the tube is still in the correct placement, or ensure that the feeding is given at the correct time? Or is it verify that the feeding solution prepared matches the dietary order, or aspirate abdominal contents to determine the residual feedings? Oh, I love this one just the same. I love this one too. When you're preparing to feed a client via a nasal gastric tube, which of the following is the most important action for this nurse to take? Okay, and these are all very good actions, very good. But oh, that's all I'm gonna say. These are very good. Hey, I'm so happy to see we have over 900 nurses, and hey, 200 of you guys, over 200 of you guys got it right. Check to see if that tube is still in the correct placement. Very important. Very, very important. Ty snuck up and gave us a new winner right now. So hey, let's keep going. And just remember, assessment. Checking that NG tube is in the right place. Okay, is going to ensure that you don't create an aspiration situation for the patient, which is going to be the most severe situation that the patient can have. Okay, good job. Moving on, the nurse is giving health teachings on exercises and physical activities to a client with multiple sclerosis. Okay, the nurse determines the need for further teaching if the client verbalizes which statement. Is it exercising with minimal rest helps build my stamina? Proper stretching should be done before starting my routine. I have recently added brief walks in the park as part of my routine. Or I can lift weights and do resistance training. Which determines a need for further teaching? Okay. In other words, which statement is wrong? Think about it. Share this video for a prize right now. Share this video. Oh, this was tricky. A lot of people didn't get a chance to answer this one. The correct answer was exercising with minimal rest helps me build my stamina. No, we don't want to see that for our patients. No, we definitely don't want to see that. All right. Especially patients with MS. People with MS are encouraged to do physical activity at a moderate level and at regular intervals. Exhaustion and fatigue may worsen symptoms of multiple sclerosis. Okay, exhaustion and fatigue. So we don't want them to rest without any, we don't want them to exercise without any rest. That's not going to be helpful for them. Okay. All right, we're having fun. This is such a fun way to study. Mr. James is admitted with an acute asthmatic episode. Oh my goodness. Which factor should the nurse expect to be the provoking factor that caused the asthmatic attack? Is it he wore a new suit made of synthetic fur 2 days ago? He stayed up late as he was out at his local bar. He smoked more cigarettes than usual during the past week. He slept on a new feather pillow. Which of the following caused his asthmatic attack? It was acute. And if you're still trying to get in, go to kahoot.it, and the game pin is right there at the bottom. 3585566. Okay. What is going to cause an asthmatic attack? Is it the suit made of fur? I've never seen a suit made of fur. All right. Is it smoking cigarettes more than usual? It is going to be the green one. Yeah, it's going to be the green one. Who got that one right? All right. Yes, Michelle, you did. Next prize alert. What is the prize going to be? The first person to 10,000 points gets a 60-day Q bank. All right, let me keep going here. I love that prize. I love it. He slept on a new feather pillow. Okay, so remember, clients with asthma, one of the biggest treatments is to identify your triggers. And so we need to be able to educate our patients on medications and other asthma management strategies. Clients should absolutely not use foam, feather, or down pillows. Okay. All right, here we go. Next question. The physician orders for Mr. James to have a respiratory exam. Okay. The nurse is aware the purpose of the pulmonary function test is to evaluate the function of his cardiopulmonary circulation, evaluate which areas of his lungs are affected, determine the extent of the ventilatory deficiency, or determine the cardiopulmonary perfusion functions. What is the purpose of the pulmonary function test? Hey, let's go. Let's go. I am so excited. Everything is coming up in Nclex. I love it. You guys are coming in, you're playing, you're answering. Hey, a lot of you guys got it right. You do know what a pulmonary function test is. Yes, you couldn't be tricked. You could not be tricked at all. Samantha, I see you. Where everybody else at? Come on. Mickey is making a comeback with 3 in the row. All right. That's how we play this. All right. And so the pulmonary function test, it is going to show decreased pulmonary volumes and decreased diffusion capacity. This is important, guys. This is important. Okay. Next question. Mrs. Smith requests pain medication 2 hours after she received the previous dose. 2 hours after she received the previous dose. What is the priority action of the nurse? Is it going to be assess the pain, educate Miss Smith that it is not quite time for her medication, give Miss Smith her medication, or notify the physician that she is still in pain? Woo, this is a very common scenario. A patient, they just got pain medicine 2 hours ago. All right, but she's saying she wants some more. She's saying she wants some more. If you are logged on to Kahoot, go to just press the color. All right, go to www.kahoot.it and put in that game pin down at the corner of the screen there. And you will tell us what the priority action of the nurse is. I love it. This is super fun. Assess the pain. Yes, no matter the situation, you got to go back to assessment. Assessment, assessment, assessment. So very important. Okay, I see my winners. And again, listen, guys, especially you guys who are going to be taking the next generation Nclex in 2023, it's coming. And you have to be able to identify assessments in these case studies. You have to be able to do it. So keep it in mind. Keep it in mind when you're reading Nclex questions. My students in nursing school, assessment is always going to be your first step. Okay. Always going to be your very first step. Okay. Information to join the game is up there if you are just watching us. We got almost 1,000. A new nurse is working in the ED, the emergency department, using the best judgment. Who is the best team to cover the triage area? Is it going to be an advanced practice nurse and an experienced nurse? Is it going to be an experienced RN and an inexperienced RN? Is it going to be an experienced LPN and an inexperienced RN? Or should it be an experienced RN and a nursing assistant? And a nursing assistant. Now think about what happens in triage. What is the main function? What is the main function? Okay. Very, very important. 2 no. Less than 6 seconds. Go ahead and put your answer up. All right. I kind of got tricky there. You want to have a yellow, which is an experienced RN and an inexperienced RN. All right. Let's see. Michelle's still on top. Michelle G. Okay, I see you, Ty, Nay, and Ms. Montgomery. You are in there as well. The ties could change, but remember, triage requires at least one experienced RN. Okay, and if you put that experienced RN with an inexperienced RN, then there's an opportunity for mentorship and also exposure to new patients in new triage situations. So you will benefit as a unit by doing this. This is going to be the most important. Okay. When a nurse is given trauma clients to care for, when a nurse is given trauma clients to care for, which of the following is considered one of the priority elements of the primary survey? Is it a complete set of vital signs, brief pupil reaction assessment, palpitation and auscultation of the abdomen, or the initiation of pulse oximetry? And I've done this one. I've explained primary survey before. So if you are following REMAR, then you know this. Shout out to you. Natalie says, I'm learning so much. Love that. 10 seconds left, guys. Go ahead and commit to the answer. The faster you answer, the more points you get. And we had the majority of you did not choose the correct answer. Remember, I told you who got it right. Let me see. Does this change our leadership board? Little bit. Michelle G, go ahead and screenshot because you also made it to 10,000 points. Listen. Wow. And go ahead and email support@remarreview.com to claim your prize. Love it. Remember, so the brief pupil reaction, that's a part of primary survey. So primary survey is literally things that you can do without equipment. So the vital signs, assessment of the abdomen, and initiation of pulse oximetry, those are considered secondary surveys, right? So remember, usually with Nclex, they will put it in maybe a disaster scenario where a nurse is working during a hurricane or working during an electricity outage. So your primary survey are things that you're going to be able to do without any kind of equipment. Okay, so if you scan a patient, you look for open wounds. You speak to the patient and listen for a response. These are part of a primary survey, things you can do very quickly without any kind of technology, basically. Okay. I'm so glad that you guys are learning. Here's this one. A nurse has a license that has recently expired. Okay. Which of the following statements is correct? Is it the nurse has a 14-day grace period to practice and renew the license? Is it the nurse may not practice until the license has been renewed? Or is it the nurse will have his or her license revoked by the Board of Nursing? Or the nurse needs to wait 90 days before retaking the licensure examination? So this is a great question. What happens when your license expires? All right. What happens when your license expires? A lot of you may not have thought about this. And so that's why this is a question. That is why this is definitely a question for you all. Okay. What do you think? The right answer may get you a prize. It may get you a prize. Hey, good job. The majority of you know what's going to happen if you let your license expire. And that is, you're not going to be able to practice. No, you're not going to be able to practice. Okay. So if you don't have an active nursing license, you cannot practice. So it's very important to do that When it comes around. Mine's come around every August. I got to do it. Okay, next question. We are moving on. The nurse interviews Mr. Johnson regarding the effectiveness of digoxin, as well as any adverse reactions. Okay, so she's interviewing him. Mr. Johnson's statements are considered to be which of the following? Okay, is his statements objective data? Are they clinical statements? Are they subjective data? Or part of the nursing diagnosis? What says you guys? Oh yes, oh yes. I see that. I see over 200 nurses in less than 5 seconds know this, and they're answering it. Yes, 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 yes. 15 more seconds. Mr. Johnson, what he says, is that objective, clinical statement, subjective, or part of the nursing diagnosis? Absolutely. You guys know it. Good job. Blue was the right choice here. I saw a lot of blues on Facebook. Yeah. Samantha is still in the lead. And you guys know subjective data is the client's point of view. That's the difference. So whatever the client feels, their perceptions, their concerns, okay, that is going to be subjective data. All right. Carlicia, you are very smart. You are very smart. Okay, here we go. The nurse needs to obtain an accurate weight for the client's medical chart. The nurse needs to get a weight for the client's medical chart. Weight and vital signs are an example of which of the following? Is it objective data? Is it component of a diagnosis? Is it subjective data? Or is it the assessment goal? What is the goal? Okay. Yes, I love it. I love it. This one should really be a gimme. All right. Yes. Hey, lots of Facebook. I love the colors. And we're talking here. We're playing games. But you guys are learning too at the same time. And you're demonstrating your knowledge. And you're winning cash for it. Top winner is going to get $100 tonight. It's really that easy. What can you do with $100? I was expecting these results. I was expecting it. And did it help anybody? Yes, it did. It sure did. When we're talking about objective data, we are now talking about facts that are measurable and facts that are observable. They're measurable and they are observable. So good job. That's the difference between subjective and objective. Okay. And we made my goal over 1,000 nurses. Next question. A nurse is caring for a client with a diagnosis of acute appendicitis. All right. And so blank is found in the right lower quadrant, 2/3 of the way between the navel and the anterior iliac spine. What is it? Is it McBurney's point? Is it generalized pain, the point of maximum pain, or the peritoneum? What do you guys say? What do you guys say is going to be the correct answer here? What do you guys say is going to be the correct answer here? You got 25 seconds to get it right. Get it right. Get it right. And a lot of you are in agreement. And so we know when we have a lot of nursing students in agreement, we know that this is a very great fundamentals question. We love our fundamentals questions because they help us. They help us figure it out. 3, 2, 1, and the correct answer. Absolutely, it's McBurney's point. That's the only thing it could have been. Okay. McBurney's point, it is found in the right lower quadrant. This is also where you're going to have your major signs of appendicitis. Okay, you're going to have major signs in the right lower quadrant, 2/3 of the way between the navel and the anterior superior iliac spine. Okay, anterior superior iliac spine. Very important. Got to know those landmarks. So if a client was standing in front of a campfire and could not feel the heat burning the skin, which lobe is damaged? Okay. Standing in front of a campfire, you can't feel the heat burning the skin. Which lobe is that? Is that the occipital? Is that the medulla oblongata? Is that the frontal? Is that the parietal? Yes, I'm taking it back. I'm taking it back to Anatomy 101. You better know the brain. You better know the brain. Think you're going to be a nurse. Okay. Which lobe is damaged? And listen, if you don't know, just keep it real tonight and say, I don't know. But you need to choose one, though. Okay. You need to choose one. What is it? Now I see the answers are dividing. Somebody's like, I don't know. I have not looked at this. I do not have my notes from anatomy. Basic anatomy. You got 5 seconds left to make up your mind. I love the honesty. Listen, I just don't know. Which lobe is it? And you can tell because like it's even across the board. People are just going for whatever. All right. It's the parietal lobe. Okay. Okay. That leadership board changed a little bit. All right. The parietal lobe helps us remember with the ability to sense hot and cold. I'm about to turn this game all the way around on y'all. Okay. Let me see what else. Okay. I'm sticking here. If a client is complaining they cannot watch the evening news on their television, which lobe is damaged? Okay. All right. Is it the occipital lobe? Is it the medulla oblongata? Is it the frontal lobe? Or is it the parietal lobe? Okay. Can't watch TV. What part of the brain is going to be damaged? Those numbers are going up. This is Nclex Game Night by Read Mar Review. I'm so happy you decided to join me. I hope you never miss one of these. This is a new thing. Let me know if you love it or not. Put hearts on the screen. Let's keep this going. I think it's a great time. I think it's a great idea. Shout out to Team Read Mar, always coming up with the latest hotness for us to bring to the community. We love you guys so much. We just want to see you passing, getting that nursing license. Which lobe is going to be damaged if you can't watch the news? Hey, occipital lobe. Yes, good job. Excellent. Get those answers in fast as possible. Okay, get those answers in fast as possible. I'm loving my leaderboard. I got to get a quick pick. Right now, Michelle G still in the lead. Here we go. Occipital lobe is what helps us. All right, and it's responsible for our vision. It really is. Did you guys remember that one? Here we go. Making a turn in this test. A client has been newly diagnosed with left side eye blindness. Okay. The nurse should promote independence by placing items on which side of the patient? Is it the left? Is it overhead? Is it the right side? Or is it hiding items, then asking the patients to find them? My. Okay. We're talking about something here so important. Yes, we are. We are talking about a patient with left eye blindness. And where should those objects be placed? What are we going to do? How are we going to take care of our patients the very best way we know how? This is definitely a teaching. This is definitely a teaching point. Yes. Yeah, definitely a teaching point. And I'm hoping we got it right. The majority of us did. Excellent job. Excellent job. We are going to make sure that we put those items, okay, on the right side. And so the right side is the appropriate side for items to be placed on. Also, the nurse should approach from that side as well. Remember, if a client is blind, you don't have to shout, okay, when you are teaching them or when you are entering the room. Don't do that. Don't do that. It's not necessary. Not necessary. Okay. Here we go, guys. All right. This is where it's going to change. The leadership board is going to change. I'm telling you. A client is just returning from a right eye cataract removal surgery. The nurse knows the best position for this client post-operatively is which of the following? Is it the high Fowler's position, Trendelenburg to decrease intraocular pressure. Is it the right side lying to promote drainage, or is it semifallars? Okay, we're talking about a cataract removal surgery. Which position is going to be the best post-operatively after the surgery? Is it high fallars, Trendelenburg, right side lying to promote drainage, or semifallars? What saith the Remar nurses on tonight? What would you do? Okay. This test, I've been taking it easy on you guys. No more. No more. We're kicking it up a notch. Oh, and most of you got this one right. Semifallars. Hey, surprise me. Surprise and shock me tonight. I knew it. That leadership board is changing as we speak before our very own eyes. Semifallars is going to be the best position, 30 to 45 degrees. All right. After a cataract removal surgery. Moving on, difficulty. Here we go. A nurse is caring for a client who is legally blind. The nurse is aware his diagnosis was confirmed by which of the following results based on the Snellen's chart? Is it 2050? Is it 2100? Is it 2200 or 2060? Which one is most appropriate for the client who is legally blind? Okay, based on your Snellen's chart. And I know you got a Snellen's chart in your back pocket because you a dedicated nurse. So go ahead and pull it out. Bam, look at it. I know you have it, right? No? Then take a guess. What color is it? 2050, 2100, 2200, or 2060? I am happy because I want to know who's going to be the ultimate winner of the first ever Nclex game night here at Remar Review. Hey, and the majority of you did get it right. Let's see. Do we have any changes? Going back and forth, going back and forth. Let's go some more. 2200. Okay. If a person is 2200 with the best corrective lenses, they're still legally blind. Okay. They're still legally blind. Okay. We're getting close to the end. A nurse is caring for a client with glaucoma. The nurse knows the progression of the disease is which of the following? Is it loss of central vision first, followed by peripheral vision? Decreased perception in color, followed by loss of central vision? Is it loss of peripheral vision first, followed by central vision? Or is it blood in the inner eye chamber causes peripheral vision loss? We are talking about glaucoma. Okay, I'm just going to let y'all sit with those answer choices. Yeah. Let's go. You got 5 seconds left. All right, let's take a look at the leadership board. A lot of you did get it right too as well. All right. I'm amazed and I'm so excited. I thought it was getting challenging. It is a little bit though. The loss of the peripheral vision first, followed by central vision, is going to be the hallmark of glaucoma, right? And we know glaucoma is the increased intraocular pressure. So for Nclex, when you think about glaucoma, think about just hypertension in general, because the treatment for glaucoma is going to be what type of medications? Beta blockers, right? And so you need to know that correlation, and it'll help you a lot. Honestly, it will help you a lot if you make the connection now. Okay. All right. Let's move on to the next question. A client is being treated for chronic glaucoma and is prescribed a carbonic anhydrase inhibitor. Which of the medications fall under this classification? This is it. Okay. All right. Is it deprivarin, pilocarpine, acetazolamide, or carboxyl? Which one? This is where we got to think and we got to commit and we got to do it fast. Okay. And if you ever get a question on Nclex and you don't know what it is, you better just pick something and get ready for the next question, because that's how it goes. I don't want y'all harping on questions on Nclex. You either know it or you don't know it. Okay. Yay. Listen, you see me. I had to take my time and concentrate for every medication. All right. Hey. Oh, it's even across the board. The correct answer was blue, though. Yeah, the correct answer was the blue one. Let's see. Did we change leadership board? All right, Ash T. I see you. I see you. New winner alert. New winner alert. What is the winner? Okay. Thank you for sharing. Hey, our first quick facts for Nclex book goes to Fletcher Monique. See, 3 more will be selected. I told y'all to share, share, share. So, Monique, you are going to get quick facts for Nclex. Congratulations. I love that book. That's going to help so much. And all the medications that you need to know for the exam are going to be in that book. So congratulations. Go ahead and email us at support@remartreview.com. Let's keep going. I'm having a good time. So acetazolamide is going to be the carbonic anhydrase inhibitor, and it is used to decrease intraocular pressure, right? Which is what glaucoma is. Don't forget. And so we're talking about the specific class of medication. The deprivarin it's a prodrug of epinephrine. Okay. And so it's used to treat open angle glaucoma. The pilocarpine is a non-selective muscarinic agonist used to treat glaucoma. Okay. All right. Great information. You are learning a lot tonight. Here's the next scenario. A nurse is caring for a client returning from surgery to repair a retinal detachment. Which of the following will the nurse include in the plan of care? Is it keep the client in the prone position to decrease ocular pressure, cover the affected eye with a patch, teach the client to avoid watching television for 72 hours, or before leaving the hospital, have the client read discharge instructions? What saith you guys when we are talking about the retinal detachment? Okay. What are some things that need to happen for this patient? And I'm liking what I'm seeing. I really am. I'm liking what I'm seeing. So go ahead and put it on the screen. Take your time, but can't because time is up. So definitely covering the affected eye with a patch. That's going to be the best thing for everybody to do, okay, as nurses for retinal detachment. And the reason why is because it's going to ultimately decrease eye movements and the risk of detachment. Eye patches are very helpful. All right. The nurse should not put the patient in the prone position, right? Think about what prone position is in your mind. Envision it. No, it's not going to be great. It's going to increase intraocular pressure and also could possibly damage the eye. The patient is face down. All right. So we don't want to do that. Sit. An adult with a detached retina asked the nurse what may have contributed to the development of his condition. Right? I'm focusing in on the eye. So what is a risk factor associated with this condition? Is it hypertension, cranial tumors, nearsightedness, sinusitis? What do you guys say? Hey, we're talking the eye. And I switched it up on you guys. We went through many subjects, but we are here right now. Are you here with me? I think you are. You got less than 10 seconds right now to go ahead and put this on the screen. What color are you going with? You guys are doing so good. I can't believe we have over 1,000 nurses All right. And only 44 of you guys that are playing chose the nearsightedness. So the correct answer was blue here. And it looks like, I don't know, did everything stay the same? Did any of my top winners get it right? All right. Malahan, I see you climbing as the highest winner. What usually happens is the person that wins is not even on the scoreboard. That's what usually happens. So I'm excited. Nearsightedness, myopia, or nearsightedness is a predisposing factor in the development of a retinal tear, which could lead to retinal detachment. Yes. Yes, 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 yes. Okay, a nurse is asked to perform care to an artificial left eye. The client asks the nurse to clean the false eye. Cleaning the false eye. The nurse is aware to use which of the following to do this procedure. Is it going to be mild soap in warm water? How about iodine or providine solution? How about 0.45% sodium chloride? Or should she use full strength peroxide solution to clean that eye? To clean that eye. It's going to be very important to know the correct solution for this. Okay. And I think this is the final question, guys. So hurry up and get it. I think we're coming to a close with game night. Over 1 hour strong of studying a very fun way. I love it. How do we do? Oh, it is indeed mild soap in warm water. Mild soap in warm water. And the reason is because, hey, that's all that's needed. Okay. The nurse should avoid using harsh solutions such as peroxide to carry out this procedure. Guys, I had such a fun time. I'm about to show you who the winners are, but we gave out some prizes today. So without further ado, here are our winners. Okay. The game night podium. Okay. Number 3 goes to Nay. Okay. 2, Ash T. And number 1 winner, Spotlight, you win $100, is Michelle G. Congratulations. Ash T, you're going to get $50. And Nay, you are going to get $25. We had runner-ups as well. But on our first ever game night, great job to everybody who played. Go ahead and screenshot. If you are a winner, go ahead and take a screenshot right now on your phone of your score, so that you can have your ranking and you can send it to us. Congratulations to every single one. Lakeisha, Joan, shout out to Miami in the house. Shout out to, who else was in the house? Kenya. I love it. I love it. I love it. So we will absolutely be doing this again. I hope you guys had a fun time. This is my very first ever hosting a game night. Whew, tons of pressure. But I think I kept you guys engaged in the game. But we used a lot of our togetherness, Team Remar. I just want to take a second and just shout out Team Remar, because we are constantly thinking about ways that you can have a wonderful time studying. And we actually go live every Monday. Every Monday at noon, I go live and do Nclex questions. So please like the Remar Facebook page or subscribe to our YouTube channel so that every time we have an event like this, you will be able to participate. Thank you guys so much. From the Philippines is in the house as well. This was so much fun. People, I love this. I can't wait for the next one. Yeah, we're going to have to do this. We definitely going to have to do this, because this was not only was it a fun game, but it was also a powerful study session. It was a powerful study session. So if nobody has ever told you this, I want to be the first person to tell you that you can, you will, and you must pass Nclex, because with God, it is possible. It is possible. And so Team Remar, thank you guys again. Thank you, Remar nurses, for coming together for the community. And we have the prizes that we will send out. Please make sure if you want a prize, you will absolutely email us, support@remarreview too. Also, if you have not gotten into your Nclex virtual trainer, take a minute, study it, get in there, print out the calendar, renew it. Okay, renew your virtual trainer if you need to as well. All right. And then also, Remar nurses, if you signed up for tonight, please check your email because I'm sending out everybody that registered for this game something special. So check your email as well. Many, many thanks again to you guys. All right. I'll see you guys later. I'll see you guys on Monday. Okay. And we'll do it again. I'll read through the comments on the screen if you have any kind of suggestions for our next one. If you want to pick a topic, what should we do next? Maybe focus on legal issues, pediatrics, psych, pharmacology. Pharmacology would probably just make our minds explode if we did it. But we can do it. We can, we will, and we must pass Nclex. See you later, guys. Bye-bye.